And now, we're bringing that conversation straight to you. Introducing The Health Link, a brand new live radio show every Tuesday at 1:30 p.m. right here on ZIZ Radio. Hosted by the Ministry of Health, The Health Link keeps you informed on what's happening within the ministry while delivering the health tips and advice you need to live your best life. This is more than a radio show. It's your link to a healthier St. Kitts and Nevis. Join us every Tuesday at 1:30 p.m. on ZIZ Radio, The Health Link, because a healthier nation starts with you.
You know that health is wealth and ital is vital. They're not just some rhyming words. It's something that's just got to be heard. Who is responsible for your health? Look in the mirror, it's your very own self. You can't rely on nobody else. Health is wealth, ital is vital. Try and take care of yourself. Health is wealth, ital is vital. You can't rely on nobody else. Health is wealth, ital is vital. Try and take care of yourself. Health is wealth, ital is vital. You can't rely on nobody else. Tracking with the herb at the field for the healing of the nation. Fruit and vegetable for medication. So much food, so much variation. Sustenance for all generation. It's there in abundance. Vitamins and minerals and whole heap of nutrients. Anti-inflammatory and antioxidants. Give your temple a chance, cause health is wealth. Vital is vital. You gotta take care of yourself. Health is wealth. Vital is vital. You can't rely on nobody else. Health is wealth. Vital is vital. Try and take care of yourself. Health is wealth. Vital is vital. You can't rely on nobody else. Vegan, we're vegan. Plant-based, we say. Long time Rastafari. Say I dey so he dey. Ital, we ital.
That's right, Ital, we Ital. Health is wealth, and of course, you know, the healthier you be, the more productive you are. As they say, a healthy nation is a wealthy nation, and you want to be a part of that, of course. And of course, we have another episode of Health Link, and we have a lovely host here this afternoon. I'll introduce as Chef Rich. Can I do that? Siobhan, the lovely Siobhan, she's here and she has a guest with her, which I will let her do the introduction, of course, and turn the microphones over to them both. Good afternoon, guys.
Good afternoon, and I just want to welcome everyone again to another episode of The Health Link, coming to you from the Ministry of Health. Everything is connected and your health is linked. In studio with us today, we welcome back Dr. Jensen Morton.
Good afternoon.
Wonderful, wonderful. And he is here to give us an update on the new or upgraded private ward at the JNF Hospital. So some very interesting things happening at JNF. And even though we are going to be having a new hospital in the future, we are not neglecting JNF in the meanwhile. And lots of work is still being done there weekly. To improve patient care, make everybody more comfortable. So welcome to the Health Link once more, Mr. Morton.
Thank you
Dr.
very much.
Morton.
It's okay, but thank you very much. All right, so I'm going to speak a bit on the private ward, and then I'll answer any other questions that that you may have, just in case there's something that more clarity is needed on or something that I may have missed. So the private ward in the hospital, I'm sure that everyone that's familiar with JNF would know that it's had a private ward since way back 2003 in terms of the current ward and the current location. Now, the plus of the private ward is that it was always a unit that had individualized rooms in one collective space. So it was the spot that had your individual room with your own bathroom, and that was how every single unit was. It was a place of an increased amount of privacy. Now, when we had the COVID pandemic, the private ward, it was realized it was the best place to turn into the holding station for patients that had COVID, because since it had individualized rooms, there was the ability to isolate each individual person. And there was no other part of the hospital really that had a layout that was conducive to that. So it became the station for that. And it remained there, or it remained with that purpose from 2020 until 2022. So at the end of the pandemic, the ward was actually closed for a few months. When we went through the process of taking a look at it for the first time, which would have been around September in 2022, that's when it was noted that it was in a gross state of disrepair. That's me being nice. It had issues with everything from the roofing to the floors to the individual rooms, the air conditioned units. Because of the nature of COVID, the AC units could not be used. So all of them actually had accumulated, most of them, had accumulated some damage. There would have been mold buildup because it was closed for such a long time. And then the roofing issue, it was realized that a leak had developed that did not get the opportunity to be attacked in the early, so it actually became significant and needed a bigger fix. So we had to keep the unit closed for a while, and we had to go through quite a number of changes and fixes and upgrades. We had to get the roof basically redone. A good chunk of it was done by a company from Taiwan, which did a very good job for the main parts of it, and then a local company would have then come in afterwards to do the final aspects of it. The Taiwanese company would have also done mold remediation on the entirety of the building and would have done repainting of the entire area. The infection control team would have gone multiple times to the unit to clean, reclean. We can't take any chances with anything. So it was clean, reclean.
Tested.
And tested. Well, all parts of the
Yes.
hospital, as part of infection control, it is routinely tested. So it was always tested, retested. So that was also happening. We then took the opportunity to redo all of the bathrooms. So the tiling work, the showers, the toilets, all of that was redone. The lighting was redone. All of the furniture was completely changed and upgraded, not just a change, but an upgrade. And all of the, of course, air conditioned units were changed and upgraded. And yeah, so basically we did for persons a brand new ward on the existing compound of the hospital. So the private ward is very important because it's 15 rooms that are going to be there in that location. Now, apart from the private ward, if you want to get a private room in the hospital, in the entirety of the rest of the hospital, scattered across the different wards that we have, there are only 12 other rooms that are individualized rooms. So how the hospital is built is that every ward still has one or two rooms that are there that are private rooms, but the main collection of private rooms is in the private ward. So in the absence of private ward, you only have 12 rooms that are privatized rooms for all different areas, and it's all segmented. And with the private ward, it increases it to 27 since it has 15 rooms. And for persons to be more aware, there are only 3 on medical ward, 3 on surgical ward, 4 on the maternity ward, 1 on the pediatrics ward, and the other one is on the ICU, but that one is not one that someone pays to go to. That one is one isolation room in which, if it's deemed that you need to go in there, that you go in there. So you could nearly say it's 11, and that with the private wards addition, it's now 26. So also because it's so split up, you could understand that if you simply have 5 persons that have a medical ailment and they all want a private room, we only have 3. Whilst the private ward, it is anyone can go in there. It does not matter what you're dealing with. It does not matter your segmentation of what's your issue. You can go on private. The only thing is we try to avoid pediatrics there. That's the only one that we avoid. But everyone else, no matter what you're going through, you can opt to go into the private ward. So the lack of having it was something that was causing some issues because as modern times have come, more and more persons are desirous of having a private room, and it only makes sense. When someone is sick, they're very vulnerable, And depending on what you're ill with, you can consider it to be something embarrassing or something that's exceptionally private. You don't even want the possibility of a conversation to be overheard by someone next to you, or you might be going through something in which it could be something that's making you, for example, just pass a lot of stool, and you're concerned about persons around you feeling like you're stinking up the place. Thinking of it that way.
Yes.
Or the other way around. The other people around you are having that condition, and you're now in a situation where you're subject to malodorous stuff over and over again. Or the list goes on and on. So in modern times, what would have been the older way of dealing with medicine, in which, people would just think, oh, it's a hospital, throw your shame at the door and just go through everything. People are becoming less and less open to that concept and more insistent on having their privacy. So that change would have happened in the States, places like the States, Canada, Japan, Europe, etc. That happened since like the 70s, 60s. So in those places, the bulk of their hospitals, in the bulk of the beds that they have available, are privatized automatically. So like the whole hospital is like the private ward that we have. So for those centers, when COVID came, it was very easy for them to make the adjustment. And then when COVID came, it kind of highlighted to us, okay, the older way of doing things, it was from colonial days. All of the other islands also do it from colonial days. All of us need to make the change. And that's why we stepped up to the plate with the new hospital. And it's being designed with an overwhelming majority of private rooms. The most that will share a room is 2 persons, and that's just for 20 of the units total. All of the rest of the units are individualized rooms, and it gives a lot more freedom, such that you don't have to. So, for example, right now, the medical ward can hold 37 people. And it's very possible that even though the entire current hospital has 165 beds, if you include the cots and the cribs, it's 165. If private ward opens, the total is 165. It's very possible to have the hospital's total occupancy just be 80 of that 165. But the medical ward with its 37 rooms, it's actually full. And you don't have that amount of flexibility. When it's individualized rooms, it's very easy for you to just say, well, this room, we're going to put the other person in here, because it doesn't have to have this specific label. So the reopening of private ward, it does multiple things at one time. Apart from it existing for us to offer that service to persons that want that privacy and that insist on it, it also serves as the main training ground that we're going to be using for when we get the new hospital, which is basically going to be nearly entirely like the private one. So it gets people accustomed to the atmosphere, accustomed to the environment. We'll make sure that all of the staff get their chance to rotate through it for them to get back the state of mind as to this is how it's going to be, so that it's not 100% jumping into a completely new environment. Now, the other thing is that it actually served as a main source of revenue for the hospital as well, something that we've been not able to collect for quite a few years. The thing with private ward is, yes, you get your privacy, but we just insist that you pay upfront, and a lot of the benefits that you otherwise would have gotten for free. It's just that we're going to tack the charge to it now. And that's your choice. We have enough space to always take persons that can form parts of the regular government system, meaning, you're over 62, you get the discounts and other stuff in which discounts are applicable. We can look for people that might be on a PAP and stuff, like lots of ways in which you can get the ability to not get charged. If you're in the 6-bedded unit, for example, that unit, you can stay in that unit and not rack up a charge, especially if you're over the age of 62. So, but with private ward, since you pay for it, and it's your choice if you want to pay for it, it allows us to gain back some of the revenue, rather than it just being that the hospital basically is consistently bleeding funds. So it's the closest thing we have to a private system overall. And again, it allows us to regain the revenue.
And what about when you have like foreign patients, visitors? It allows us to really collect revenue on that
Yes,
end? And will there be separate, different
well,
charges for
it-
locals and?
I wouldn't say different charges.
Okay.
It's how it always was in the system. If you came and you were not a citizen or a resident, so
Yes,
you're a
okay.
tourist / a visitor, you were automatically put on the private ward, and
Okay.
you were put to basically pay for the healthcare because all of these major subsidies that the government does, it's for tax-paying citizens. So even though I
course.
say it's subsidized, you pay for it from VAT. You pay for it from when you go customs. You've paid for it. You've already
Yes.
paid for it. So on paper, when we charge people, the additional charges that are applicable to them, excluding the private ward, we usually generate around like $5 million in revenue a year. But the hospital itself, it costs like $52 million. But it's not
Per year to
operate. But
And-
it's not to view it as a loss. That $47 million that it's subsidized by, it's paid for by you, the citizen, already
To taxation.
through aspects of taxation. Now, when it only gets problematic, basically, if someone that's not a tax-paying citizen happens to come here and happens to enter the system, unfortunately, you will have to pay because your taxes have not contributed to this system. So we just simply ask that, okay, we'll put you here so that it's easy for the paperwork and you just have to pay for what you use. Now, in the absence of the private ward, basically, we've had some difficulty in getting that revenue. We do some aspects of billing to try to control for that, but it's still not optimal with regards to how much we can actually get in. So with the private ward being back up and running, it does allow for that whole, let's call it deficit, because it is a
Yes.
deficit, but it allows for that whole deficit to be reduced.
Wonderful.
So something else I can speak about is we actually have completed the infrastructural work for quite some time. What we are waiting on is just the additional staffing. So to explain everything fully, again, everything is in training for when we get the new hospital. One of the things we aim for is accreditation. And accreditation simply means that the hospital is operating at the same standard as whatever is the international standard. And in our case, we are going for the accreditation program that is the same that is used by Canada, just as reference. It's called Accreditation Canada, but it's used by multiple places. They have other accreditation bodies like JCI, etc. That's a higher order one in the States, but we're going to start with Accreditation Canada and then work our way upwards. Now, when we make the dedication towards reaching these standards, we have to try to see everywhere in the system that we can improve it to ensure that it's up to this par. One of the areas that we struggled with was nursing ratios. Now, when it comes to nursing, they have pretty textbook figures that they say you have to reach. Depending on the type of patient that you have and the level of care that the patient needs, the ratio of patients to nurses, it's very much strict and written textbook, and you have to have this amount and this amount and this amount. Now, not just St. Kitts, but all of the islands in the OACS, we struggle with actually reaching those ratios. And what we've compensated with all the time is the nurses, they just have more patients to deal with, and that's just how it's been. So in the States, if it's like 1 to 3, 1 to 4, in all of these islands, it's like 1 to 6, 1 to 7. And that's just the reality of the amount of nurses that we have. So when we were reopening the private ward, we really said we're going to make the endeavors to ensure that we meet the international standards at the private ward, because we're going to try our best to meet them in the new hospital as well. When it comes to private rooms, if you just think about it, compared to an open setting, you have to check on the person more often since the doors are going to be closed and
Yes.
since you don't have the opportunity to just easily peep and see everybody
Yes.
one time. So you have to have enough persons there such that they could check on a regular basis. Otherwise, you could get something in which something happens to someone and it's missed. Even with all the buzzers in the world, sometimes something happens and they don't get to
Yes.
press the buzzer. So we looked at our current nursing levels, and we had already recognized that we have a bit of a shortage. We've been operating with a shortage for quite some time, but it doesn't make sense to continue with something that needs some adjustment. So, and the nursing bodies, they have been asking for improvements with regards to the total staffing numbers for quite some time. We had tried local recruitment, which is obviously the first thing to try to get more people to train in it. We've had some level of success with the local recruitment. We are getting more persons involved in nursing, and we are very pleased to say that we're getting more males involved in nursing, because before, just trying to get one gender, it was limiting even with just one gender. But now that it's opened up and more people are open to the idea, it's really helped. But it wasn't sufficient. We started recruiting from some neighboring territories. Right now, we have nurses on staff with regards to the region. We have nurses on staff from 10 different territories in the region right now. But again, another limitation that we meet is we're part of the OECS.
Yes.
All of us are struggling. We are not allowed to poach from other islands that are struggling.
Understandable.
There's only so much you can take.
Yes.
So even if every nurse in, let's say, Dominica wants to come to St. Kitts, we can't. That's just based on principles, we can't. So they might say, okay, we could take a few if they really, really want to leave, but we just can't. So we had some limitations with the regional absorption. We started using companies from the Philippines. That's why we have so many nurses there right now from the Philippines. And that actually was working out, but the most recent place for recruitment that we started using was Ghana. Now, this was via some improvements in exchange between the Caribbean region and Africa that was actually spearheaded by our Prime Minister when he was in charge of CARICOM. And it's been very successful. And one of the countries that really reached out was Ghana. Wonderful. They had the opposite problem to us. They were training lots of nurses and they couldn't get them absorbed into their country. So they had already looked towards the exportation of the nurses. And these are very good nurses.
Highly trained and specialized nurses as well.
Specialized nurses. The only thing that they're lacking is in some instances, it's opportunity. They've been nice. They haven't been like sending out, new recruits. They are absorbing their own people that are new into their system, and those that are leaving, they tend actually to be those that have a little bit more experience to them, but they're all trained, all certified, speak English. They look just like us. So
of course.
It's a blending kind of situation. The culture clash is little. It's not that much. So Antigua took the first gallop with it, and they looked at their nursing situation. They were going through all of the same things we were going through and through all of the same steps. And they said, okay, well, to meet the international standard, we are going to need, I think when they looked at it, 120 something of the nurses. They asked Ghana send them 120, I can't remember, you can Google it, like 125 or something nurses, well trained, all of that were taken into the system. And they were doing very well with it. So then we looked at our own system. The actual gap that we had, it was to the tune of about 47. We went and we spoke to them. They said, okay, and they've basically sent the persons to be able to join our staff. In total, in our local nurses association, there are about 340 nurses, including assistant nurses and all of the ranking, nursing assistants, registered nurse, midwife, staff nurses, the whole kit and caboodle is about 340. So these additional nurses, it just helps the overall number. We still have a majority local nurses. We're not majority foreign. We're not trying to do any replacement, and we're still actively trying to recruit. But those nurses that will be coming, that will stop a major gap, and that will allow us to look at our entire workforce pool and then easily assign nurses to the private ward without having to rob any other department of the proper nurses, and allow everyone to get that rotational feel that we're aiming for. So I'll allow, I think at a future point in time, you'll have the principal nursing officer on. She'll explain everything with the nursing in a lot more detail.
Definitely.
I was just including it since it also involves the private ward.
And it's to let Kittians know that we're not bringing in nurses to take the jobs of Kittitian nurses by no means. It's actually to support them.
It's to help them in the absence of having these persons. The nurses could tell you some of the timetables that they've had. I mean, with overtime, you're paid. So even though you're paid, sometimes they say they don't even want to pay, like they're tired. They don't even want to pay. It's a lot on them. And in some instances, the physicians are also, and other members of staff, they're also pleased because these persons, they come specialized in the area.
Yes.
So they're not foreign to certain concepts. They kind of know what they're doing, kind of from the jump. So it's very easy to work with them, and our own nurses can learn from them.
Yes.
In lots of instances, whilst they also learn, of course, how we do things here, we can also learn what they learned in their specific specialty. So it's a lot of information exchange. And the employment is contractual. So just to ease any concerned persons might have to think, all of the jobs are taken up. Not really. When we get enough local persons, of course, when you're local, you're part of the civil service to get your guaranteed employment. When it's contractual, it's understood by everyone that you're here for the time period, and then if we have enough locals, then we can say thank you for your service, and it allows for there to always be space.
Wonderful. You know, we have to address that because we don't want Kittians to be feeling that we are replacing them. But as you said, it's an issue across the region
they can't. At the hospital right now, there are 35 medical specialists. Only 15 of them are from St. Kitts. 18 of them are from Cuba. One is from India. One is from Nigeria.
Okay.
That's the reality of the staffing. So even on the medical specialist side, we are majority persons who are not from St. Kitts. When you look at the pharmacy, right now, I don't have a single pharmacist I don't have a single pharmacist in the system from St. Kitts that has their bachelor's degree in pharmacy. Not one.
Wow.
They're from Jamaica, Guyana, Philippines, India. Jamaica, Guyana, Philippines, India. I think those are all the countries, different numbers from different countries. I don't have any. That's just the case. Those in St. Kitts that have it, they've emigrated, and that I can't force people to stay in St. Kitts. And other persons in St. Kitts, we've tried reaching out. Scholarships for pharmacy are kind of scarce. So what ends up happening is that you have to take out all these student loans. You end up getting all of this debt. And then when you're coming back to St. Kitts and you see the salary, you're like, it's going to take me like 7 years to pay off the student loan. But if I can get a job in the States, I could pay it off in like 2 or 3.
Isn't that an issue that all the islands face, though, with even some of the Filipinos and stuff, is that the bigger countries, the US, Canada, and so forth, are really tapping in and trying to get specialized persons.
Yeah.
And so they are the biggest obstacle to staffing for the region. Because, of course, America can offer higher...
A lot more pay.
Yes.
It's been a problem for quite some time that it's nearly like a poaching that they do. Sometimes you used to go shopping, basically, in this region to find the best of the best and then take them up, and then it's just our problem after that. That's why with some of these jobs and positions, we try our hardest to try to give them benefits and other things, but sometimes it's not enough. And in other parts of the health system... again, with our medical technologists, I think we only have 2 from St. Kitts, and we have from... so it's in the field of medicine.
Yes.
If persons from St. Kitts want to come in, we have enough room to absorb persons from St. Kitts if they come with the correct... Of course, if they come with the training and certification. Yes.
So that's an encouragement to persons out there, young persons, parents, who are, discussing careers with their teenagers and so forth. There are a number of specialties in the health area that need to be filled by Kittitians. So perhaps we can do some sort of outreach and educate the public more. Encourage Kittitians to enter into these particular types of careers.
The Kittitians, a lot of them know, I think I can't force people to... We can't force people to limit themselves with regards to the opportunities. If it is that they are looking at things and they are looking at the pay as the main thing and other aspects of things, because another one is sometimes you go away and you get married and you stay there. That's happened a lot.
They go to school and you stay.
Jamaica.
Yeah.
They go to Jamaica and I'll tell you, they would latch on to them when they're in Jamaica. They get married and then they stay up there. And that's been... That's been an issue, even though the pay between here and there is comparable. So you can't
Yeah.
say it's a pay for that. It's just
It
your
is
life
what
started
it
here.
is.
So,
Yeah, you're studying for 7 years over there.
yeah,
You're gonna
and you just
create,
get,
yeah.
yeah, so it does happen. So, oh. Oh, man.
Yeah, yeah. So we have. Yeah,
Oh,
we
okay,
have to wrap
sorry.
up now. But yeah, that's good that we explained about the nurses, and we're gonna have the piano on at
Yes.
some point, so she can give us some more details about the incoming nurses from Ghana. And so that was it, folks, about the private ward. So soon. When is it expected to open as we wrap up?
We're hoping for within the next 2 to 3 weeks.
Okay.
The staff is already here, but we have to finalize some paperwork and some orientation things, and then we'll give everything the chance to finalize and even out, and then that should be it.
Wonderful. So for persons who have been,
Quickly, what was the number of rooms you added again?
yeah.
15.
Okay.
So how much we have private rooms total? You were saying 26?
26/27. If you exclude ICU, 26. So it's going to be quite more persons that can be held that want that option. And that's just fully private. If you include semi-private, it's 34. That's rooms in which you have 2 rooms that share a bathroom. That's kind of in between.
Yeah.
But full-blown private, it's now going to be 26. And the new hospital is going to be 125.
Wow.
So it's going to be even more. So,
Okay.
all right.
Well, thank you so much, Dr. Morton. That was
problem.
very informative. So for all out there who have been wanting to, the option of having a private room at the JNF Hospital in about 3 weeks, that option will be available once more.
Yes.
And it's sounding really good. I've been able to hear of some of the amenities that will be included, and they are quite comparable with any other hotel.
Yes, and we'll do the full reveal and full display when it's time.
Most definitely.
All
Thank
right.
you so much again.
No problem.
And
Okay, there you had it. A good wrap up there. So, new rooms are coming on board at the JNF Hospital. And of course, if you like that type of treatment, we are very, very private to your own. Quick questions. I know some hotels allow sleepovers. That's allowed in those private rooms?
The only ones that we've ever done is mother to child, really, or whichever parent is available to child. And the only other time is we're trying to be more lenient with maternity, with like pregnant women
I
and
was
their
about
spouse.
to
We're
ask that one,
trying
yeah.
to be more lenient. There are certain rules that we have to have in place, but
Like the
we're
man.
looking at how is the best approach to take to allow the spouses to be together without breaching certain things.
Okay.
But yes.
Father usually be in a chair. Thanks a lot, guys.
All right,
And
no
of course, I'll see you guys in the next one, next Tuesday.
You know that health is wealth and ital is vital. They're not just some rhyming words. It's something that's just